importance in the unstable individual. It's clearly in the stable population who have plaques, and that's everybody in this room has plaques. We know that from the Vietnam War and Korean War data, where these young 18, 19-year-old recruits were killed in action. They did autopsies. Every one of them had plaques. Well, the answer is to change the metabolism in your bloodstream, the metabolic derangements that cause this. And we could do that. So really what we're talking about is taking the vulnerable patient who's got vulnerable blood and correcting these metabolic abnormalities to render that plaque less vulnerable. Basically take an unstable plaque and make it stable, and then achieve regression. So I consider myself in the bomb diffusion business, because that's what I do. I diffuse these bombs that people walk around with. And how do I diffuse these bombs? I utilize lifestyle intervention and medical therapy to correct the metabolic derangements that allow these plaques to recover, and they can disappear, as I'll show you in just a minute. That's the winning formula. That's the solution. That has the ability to save us literally billions and billions of dollars. And again, as it relates to corporate wellness, a corporation, a healthy corporation, is a wealthy corporation. You know, this is a very high-tech, pricey disease once you rupture that plaque and you get sick. And if, as I said, if you happen to be lucky enough to survive and make it to the hospital with your stroke or your heart attack, it's like the Roach Motel, because once you check in, you never check out. There's always tests and repeat casts and this and that. So clearly, the optimal approach is a prevention approach. Now, can you look at a patient and tell who's healthy and who's not? Well, of course you can't. It's in the bloodstream. Here's Jim Fix, noted marathon runner, dropped dead of a heart attack at age 53. We know who this is, Sir Winston Churchill. Winston Churchill broke every tenet of a healthy lifestyle, every one of them. Lived into his 90s. It's what's traveling around your bloodstream, and that's what we could correct. So I'm in the plaque stabilization business, and actually I've progressed because now I'm in the plaque regression business, and we can do that, and we certainly do that on a regular basis. Here in Miami, in Atlanta, New York, Los Angeles, and around the world. Things have changed. And I got to tell you, back in 1979, when I first came to Baptist Hospital, came back from California, and I set up my practice and I started getting interested in prevention, I never thought in my lifetime we would be where we are today. The ability for me to stand here and tell all of you that I can make you heart attack proof. But I can. So it's a 6-week program, and I'm going to take you through this quickly because it's certainly something that you should know, and we'll get you some interesting reading materials so you don't have to scribble notes down. But, you know, week 1 is to call your doctor, and on the front lines of this war against cardiovascular disease, which, as I say, the number 1 cause of death, not only for men, but for women. You know, February's Heart Month, and we now have a Red Dress campaign and Go Red for Women, because the number 1 cause of death going away for women is heart disease, heart attacks, cardiovascular disease, which is heart attack and stroke. Going away, it dwarfs breast cancer. And again, women can be protected just like men. You don't wait until you have an elephant sitting on your chest and you're in the emergency room to say, gee, maybe I should start doing something about this. The time to act is now when you're feeling well. So make the appointment with your primary care doctor, who is your ally and your friend, and you're going to work in concert when you're healthy to do all the prevention strategies to help keep you out of the hospital. You know, clearly, Baptist Health South Florida, we're no strangers to intervention. We have an outstanding intervention program. whether it be cardiac intervention, interventional radiology, world class. And we're not concerned because people are still always falling through the cracks. And as Brian knows, certainly we'll always be able to fill beds by people who fall through the cracks. But we certainly feel that prevention is the way of the future. And I think that this is the way to start, with your personal treating physician, getting the proper test, doing a physical exam, see if your blood pressure is elevated, make sure you don't have an abdominal aortic aneurysm, listening to the carotid arteries in your neck, and all the things that we do. The next thing that I advise, and this is going to come as a shock, why is a cardiologist talking about dental health? You call your dentist and hygienist, and you say, I want to make an appointment. Why is that? Because periodontal disease is one of the driving forces of chronic low-grade inflammation in the United States and around the world. And if you have periodontal disease, you're at increased risk for a heart attack and stroke. Now, a lot of you think that this is what we're talking about. This is a severe case. And you say, well, I don't have that. You don't have that, but I bet a lot of you in the room have this. Chronic low-grade inflammation. Your gums might bleed a little, get a little red. Many of you aren't flossing. Everybody in this room brushes their teeth. I bet a lot of you don't floss a couple times a day. We know that if you get the proper cleaning a couple times a year, you could significantly reduce the likelihood that you're going to end up with periodontal disease, and therefore decrease your risk of a heart attack or a stroke. Smoking cessation is a no-brainer. It's a no-brainer. I pulled this from Time magazine back in the 50s. I love this one. More doctors smoke Camels than any other cigarette. You know, I hate to tell you this, but 2 out of 3 new smokers in this country are under the age of 18. We haven't got this message out for kids. For people that want to stop, we have all kind of nicotine patches and medications and behavioral therapy. Week 2, get fit for life. I mean, this is nothing new. Plato was talking about this in 300 BC. Old Doc Jeremy Morris, back in the 50s, did one of the most elegant studies where he, in London, said, gee, this is the perfect experiment. As many of you know, have been to London, they're the double-decker buses. Well, he took the guys who were driving the bus, and he compared them to the conductors, who were like the ever-ready bunny running up and down and getting the tickets. The conductors had half of the heart attacks as the guy sitting in there just driving the bus all day. Well, we didn't believe that data here in the United States. So this goes back to the days when we used to deliver mail on foot. And we repeated the study and clearly got the same results. If you delivered the mail on foot, you were active, half the heart attacks as a sedentary postal worker. My 3 favorite exercises are walking, and walking, because everybody can do it. The data is overwhelming. Look at the data in women, the Women's Health Initiative. Just walking most days of the week, 30% reduction in overall cardiovascular events over 3 years. Nurses' Health Study. Brisk walking, 40% reduction in heart attack risk. And then the Women's Health Study, 50% reduction. I mean, the data is just overwhelming. Here's the Framingham Heart Study. You could prolong your life. Exercise. I wish I had 3 hours I could talk to you about exercise. Here's people that the more aerobically fit you become, the more you reduce your event rate. But the most important point I want to leave you with as far as exercise is this one. Here's people with metabolic syndrome, which is like a pre-diabetic condition, high blood pressure, cholesterol abnormalities. So if you have all these abnormalities and you're overweight, if you could just get fit, mildly fit, you radically reduce your risk of dying. So it's not getting people to run in the Boston Marathon. It's to get our 90% of Americans who are totally unfit. They get up in the morning, they drive to work in a sedentary job, come home, sit down, eat dinner, flop down in the easy chair. They're totally unfit. Get these people to walk at least 30 minutes a day. Or even better, get a pedometer. I think we have these pedometers here. Get 10,000 steps a day. It really is, I think, critical. Well, the question is, how can this be so effective? How can